All right. Hi everyone, Sayé here and welcome to the Sayé Show. Today I'm having a special guest, Dr. Hubbard of Abingdon ENT. Thank you so much for being here today on your day off.
Thanks for having me.
Absolutely. I would love to introduce my audience to you and your background. Could you please tell us a little bit about your educational background and your work?
Sure. So I grew up in Lebanon, Virginia. I went to undergraduate medical school at the University of Virginia. And after I finished my ENT surgical residency in 2015, I came to Abingdon, where I've been practicing at Abingdon ENT since.
So you have been practicing at Abingdon ENT and serving the community for the past 5 years.
That's right.
Wonderful. Knowing that, during your practice this past 5 years and before that, while you were in residency, did you experience a pandemic?
So towards the end of my medical school in 2009, there was a global pandemic, and that was H1N1, also known as swine flu. So that was a disease that started in North America, had a global reach, but was not quite as severe as this one.
What would be the difference between this one and the pandemic swine flu?
Sure. Swine flu, there were people who had significant illness associated with it, particularly large urban areas. There were a lot of hospitalizations, and nationwide there were about 12,000 deaths during that pandemic. With this particular one, it's a little bit more widespread. There are asymptomatic carriers that can spread the disease, so it reaches a little more widely, and unfortunately the expected death toll is larger than it was for the swine flu.
So more dangerous, more deadly. I see that also you have brought lots of masks, which is great because our audience last week and the week before, when I had Dr. J from Abingdon ENT on the show, they kept on asking. They asked me, should we use masks? Is it useful, because we keep hearing mixed messages that a mask won't do anything for you. So should we go and use it? And then the type of mask that is not available, and that's the one that is the best, and just lots of questions like that. So I'm so glad that you brought all these masks to actually show us how they work and the difference between these masks. Could you please go ahead and tell us about it?
Sure, yeah, it's something that we've all kind of been grappling with as we've been going through this. So it's important to sort of understand the way the disease is spread and the things we can do to mitigate that. From early on and very consistently, we've heard about social distancing. We've heard about good hand hygiene because the disease can be spread through contact as well. But it's primarily spread by respiratory means. So initially, the recommendation was for masks to be worn by healthcare providers and people who are ill and experiencing symptoms. In some countries, it's very routine for people to wear masks during respiratory illness seasons, and one of the observations that was made was that in those countries there seems to be less significant spread of the disease in countries that don't wear masks. That, along with some other pieces of evidence, have led to the most recent recommendation, which is that even those who are asymptomatic wear a simple face covering when in public. To the other questions, what are the masks, what are the different types of masks, and what does that mean? I've brought some things here to help illustrate that. This is an example of a simple procedure mask. It's just a few layers of sort of a papery fabric, some elastic ear loops, sort of goes over the nose and mouth, and this is primarily just to prevent things from the breath and from cough and things like that from entering the environment from the person who's wearing it.
And this one, is it supposed to be reusable, or this is not?
Those are ideally disposable. Due to the current shortages of personal protective equipment, we've sort of found ourselves reusing those and trying to find various means to re-sterilize them, but under ordinary circumstances, those are disposable.
Also, I have seen many people use this and wear this, but from my point of view, they were just wearing it as a fashion accessory. Like, it wasn't covering the nose, it was kind of like hanging here. So it needs to cover the nose and mouth.
Correct. Yeah, and those, the medical masks have a little thin piece of aluminum inside them, so you can sort of contour it over the bridge of the nose to get good coverage. and to make sure it fits properly.
Yeah, I see this. This is the piece of metal you're speaking about, so you can kind of firm it around your nose and yes. Sounds good. Well, thank you so much. Let's move to the next one.
Sure. So one thing that a lot of folks have heard about more recently is an N95 mask.
Yes.
And this is an example of one. This is a mask that has more capacity to filter. It filters out roughly 95% of the particles. It attaches with these elastic bands and again has a piece that contours. And in this one, because the idea is that you should be getting a high level of filtration, the fit of the mask is very important. And these are used by medical providers taking care of sick patients, as opposed to this one where the primary function is to prevent droplets from the wearer entering the environment. This is primarily supposed to be filtering what the wearer is breathing in to hopefully decrease the chance of contracting an airborne disease.
And you mentioned something, they need to be tested. Could you elaborate on that? This is very interesting subject for me. How do they test a mask to see if it's a good, proper fit?
Sure. So when you're test fitting an N95 mask, the user just sort of contours it to their face as they would with the other. But you can see on the back side here that this sort of goes all the way around and it should seal. So in the test fit, once you put this on, they put a hood over your head and they puff in a solution that has some sweetener in it. And if you can taste that sweet flavor in your mouth, then you know that the mask has a leak in it and it's not actually giving you N95 protection.
Interesting. And this is the one that we have a shortage of right now.
Yes. So N95 masks are definitely in short supply, and we unfortunately have situations in which some people are having to use the standard surgical mask, but there's a big push to get N95 masks on the front lines. I don't have an example of one of these with me, but there's sort of another level even higher than this called a powered air purifying respirator, and that's sort of like the big spacesuit looking things that you've seen on movies and you know, bio labs and that sort of thing. That's sort of even a level higher and even more scarce.
Yeah, so this is worth a lot of money right now.
It might be.
Well, thank you so much. Can we move on to the next one?
Sure. So this is sort of pivoting into that new CDC recommendations for folks to wear a simple cloth face covering in public. This is one that my wife sewed for me out of some materials and pillowcase and some other commonly available materials, but just sewn together in a way that can be tied on and worn in public. But with that comes reuse and the potential hazards of that. You know, as we mentioned briefly ago, contact is another method of spread. So when you do wear a cloth face covering in public, you want to make sure that you don't touch a contaminated mask and then touch your face or your eyes. These should be, you know, laundered separately, and you know, just be aware that it is a potential source of contamination as well as a potential source of a means to prevent spread, and just be careful and be mindful of those things as well.
So just because you're wearing a mask, that doesn't mean you're good, you're done. You really need to still be conscious of it. If you are using it, going to like a grocery store and coming back in the car and just taking it out like that and touching it actually, and then start rubbing your face or eyes, pretty much as if you didn't wear the mask.
Right, yeah. So you want to make sure that it's part of the bigger picture of protecting yourself and others, in which you're doing all the appropriate hand hygiene, wearing those cloth face coverings. Again, that's primarily to prevent asymptomatic people who may have the infection and not know it yet from spreading it through respiratory droplets in a shared environment in a public space. So this is all part of a comprehensive strategy with hand hygiene, social distancing, and wearing the cloth face coverings. Exactly.
That was one of the questions. I believe the woman named Sanaz, she from London, she asked us what are the things that is in our power? There are many things that are out of our power, and it just, we cannot do anything about it. But what are the things that we could possibly do to, you know, try not to get infected by COVID-19, or if we have it and we're asymptomatic, we won't give it to the next person. So cleaning hands, washing hands, using masks. And when we're talking about cleaning hands, I know there are many videos online that tell you how to wash it long and everywhere. What about the hand sanitizer? Are they actually useful?
Yeah, hand sanitizer is useful. Sort of a good thorough washing with soap and water is the gold standard.
Oh, okay.
But there is some additional benefit of hand sanitizer. That shouldn't be the cornerstone. But if you need to use it like after you've, been out in public and touched something, before, say before you get back into your car, quickly using hand sanitizer, that might be an appropriate use then in a situation where you want to clean your hands from recent contact, but soap and water isn't readily accessible.